How can you understand your stroke MRI results? Imagine trying to read a map of your brain after a stroke. Your MRI is that map, showing detailed images of what's happening inside your brain tissue. To understand these results, you need to know what the different types of MRI scans reveal about stroke. The most important sequence for detecting a recent stroke is called diffusion weighted imaging. This scan highlights areas where water movement is restricted because of cell injury. When cells are damaged from a lack of blood flow, water can't move freely, and these areas show up as bright spots on the scan. These bright spots indicate where the stroke has already affected brain tissue and can be seen within minutes to hours after symptoms start. Diffusion weighted imaging remains positive for about 3 weeks after a stroke, helping doctors identify recent damage. Another key sequence is fluid attenuated inversion recovery, or FLAIR. This scan shows high signal intensity in affected areas but usually becomes positive several hours after the stroke begins. When doctors compare the diffusion-weighted imaging and FLAIR results, they can estimate when the stroke happened. For example, if the diffusion-weighted imaging is positive but FLAIR is still negative, it suggests the stroke is very recent, within the last few hours. This timing information is crucial for deciding treatments like clot-busting drugs. Perfusion-weighted imaging measures blood flow in the brain. It shows areas with reduced blood supply, which might still be salvageable if treated quickly. These regions are called the ischemic penumbra. Seeing this on your MRI indicates there is tissue at risk but not yet permanently damaged. Additionally, MRI can include sequences like gradient echo or T that detect bleeding or microbleeds, helping to rule out hemorrhagic stroke before certain treatments. Your MRI results might show the infarct core, which is the part of the brain that has already suffered irreversible damage. This appears as a bright area on diffusion-weighted imaging. The size of this core is important because larger infarcts, especially over 70 milliliters, are linked to worse outcomes regardless of treatment. The MRI can also reveal the ischemic penumbra, which is tissue that is at risk but can potentially be saved with prompt treatment. If an MRI shows a blockage in a brain artery, called vessel occlusion, it helps your doctors determine where the clot is located and plan the best intervention. Timing and severity are also key. If diffusion-weighted imaging shows bright spots but FLAIR does not, it suggests the stroke is very recent, often within the last few hours. This information influences whether treatments like clot-busting medications are suitable. The size and location of the infarct can predict how well you might recover and guide your healthcare team in planning your care. MRI can detect stroke changes faster than CT scans, sometimes within 30 minutes of symptoms starting, which allows for quicker diagnosis and treatment. Your healthcare team will interpret your MRI results along with your symptoms and other tests. They use this information to decide on the best treatment options, such as clot removal or medication. The MRI also helps predict your recovery potential and guides rehabilitation plans. It is very important to discuss your MRI findings with your neurologist or stroke specialist, who can explain what they mean in your specific case. Remember, every stroke is unique, and your treatment plan will be tailored to your individual needs. Always trust your medical team to interpret your MRI results accurately and provide personalized advice based on the latest scientific guidelines.